All right, well, good morning. One of the problems or challenges with this screen sharing is not everything is right in front of you. So, good morning. Paul Swansen with you from the Swansen Report, theswansenreport.net, theswansenreport.net, theswansenreport.net. And my second cup of coffee this morning. So, let's get started. What you're seeing up here is from whitehouse.gov. And if you just go to whitehouse.gov and then click on the little thing, the link there that says briefing room, you can get up to all of the executive orders and whatnot and what have you. This is from the recent, I don't know what you want to call it, dumpster fire, a kabuki theater, a whatever. Anyway, this is from the recent, I hate to call it a press conference because it was so scripted and so planned. And anyway, so this is one of the items that came out in the press conference the other day, which I watched, and it was, oh boy. Anyway, fact sheet: Biden administration announces historic 10 billion, yes, 10 billion with a B, investment to expand access to COVID-19 vaccines and build vaccine confidence in the hardest hit and high-risk communities. What? Anyway, so 10 billion, this is coming out of the monies apparently that had already been designated. So the 10 billion is, yes, it's a lot. It's a whole bunch. So anyway, but the one, or well, one of the things that I look at here is this: build vaccine confidence. What does that mean? Should we not have confidence in the vaccine or not? Why do you have to push that we ought to have confidence in the vaccine? And what another thing that is not delineated or specified in anyone is, and these are just platitudes, generalities, the hardest hit and highest risk communities. What does that mean? We don't know, and they don't delineate on any of that. Let's look at something else down here. Administration makes essential workers eligible for vaccinations at community health centers in federal CHC vaccination program. I thought the essential workers were already eligible for vaccinations, were they not? Why was that question not asked as part of the press conference? But this was all scripted. This was all preordained. It was all just theater for all of us. And then administration also announces a new program, not a program, just a new program to vaccinate dialysis patients nationwide. I need to ask a friend of mine who has done dialysis what the particulars are on this, but it would seem to me that if these are at-risk people, why wouldn't they have been vaccinated or in that first tier of being vaccinated anyway? So anyway, let's go down here to, and now their Health and Human Services is going to invest nearly 10 billion. Well, a billion here, a billion there, and pretty soon you're talking about real money. Expand access to vaccines and better serve communities of color, rural areas, low-income populations, and other underserved communities, yada, yada, yada. Again, the funding will, now how does funding expand? Well, it's going to expand access, I guess, because they're going to have more places that'll offer vaccines for vulnerable populations and increase vaccine confidence across the country. So funding is going to increase vaccine confidence across the country. Huh? What? Who writes this crap? Obviously, some bureaucrat. And they're, why is this not? Why are we not offering vaccines to just everybody? Why do we have to be specific about communities of color, rural areas, low-income populations, and other underserved communities? We're offering vaccines for all Americans. Easy, 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 easy. This is also a great one. Equity is at the center of the administration's response. Equity? How about maybe getting people well, making sure they don't get sick again, if that's possible. Of course, there's so much stuff that's going on this that we don't know. But anyway, equity, not about your health, not about you not getting sick again or preventing you from getting sick in the first place. It's equity. So it's never about your health, folks. Come on, we know that. And speaking of equity, let's look down here. Another wonderful Washington bureaucratic boondoggle. They've created the Health Equity Task Force. Why? Health Equity Task Force, what does that mean? Just another bureaucratic boondoggle to spend money and not really take care of your health. It's just a health equity task force. They're not going to discuss anything about your health. Make sure that you're healthy. Just a bureaucratic laundry mill of bureaucratic crap that's going to go on and really not do anything, I would presume. Again, so these actions are garnering initial results. The federally, and now here's another thing. Why is the federal government doing this? Federally run community vaccination sites. We're from the government and we're here to help you. Nah, not really. Anyway, federally run, where is their impetus for doing this other than, I don't know. But federally run, that raises red flags and says, yeah, I'm not sure. But again, they are people of color. Again, code words or were administered to who and what color? Pink, purple, red, white, chartreuse, people of color, what? And again, this is one of those code words, those trigger. Well, I don't know if it's a trigger word, but it's a word that says, "Yeah, what are we talking about here?" Again, people of color. Let's go on to the second page here, and down to the health resources. Where are we? Now, I did a blog post about this, kind of related. Health Resources and Services Administration, HRSA, another bureaucratic federal government nightmare, probably, will provide funding starting in April to nearly 1,400 centers across the country. Community health centers serve 1 in 5 people living in rural communities, of which, yep, we are in one. There is, you will see down here, there is a link to, you can, a link to this program, and you can see, you can actually look at your own state by state. So that's what I did. We looked at Wisconsin. Our local community health center is not one of the places that is on the list for Wisconsin. And Wisconsin's getting a bunch of money. Again, go to the SwansenReport.net, the SwansenReport.net, the SwansenReport.net. And it is, I can't find it right now. Wait a minute. Maybe it's here. No, it's not here. That's Wisconsin Nursing Home does, which is a whole nother issue, but let's look at this real quick. Here we go. Wisconsin American Rescue Plan Act Awards. And Wisconsin is getting $59,126,375 to support 16 health centers across the state. However, our Red Cliff Community Health Center is not on the list. So, local elected officials, would you care to explain why? Anyway, you can read that more there. So let's go back to, there we go. Okay. So yeah, the allocations of monies is not equitable, not certainly a bit problematic. But yes, go to this link and check your own state. Please do that. Are we 3? Yep, here we are. So CDC is investing $3 billion to support local efforts to increase vaccine uptake and equity. I thought the point was we're getting vaccines out to put shots in arms. Increase vaccine uptake and equity. What does that mean? Now, this funding, as we have just talked about, will go to here we go. Funding will go directly to states, territories, and some large cities, enabling them to support local health departments and community-based organizations in launching new programs and initiatives. Again, layer upon layer of more and more bureaucracy in this whole boondoggle of stuff. Intended to increase vaccine access. Well, you go to your local health, local health clinic, you go to, Walgreens, CVS, wherever, call your local doctor. Most everybody at this point has got some sort of health insurance. I know not everybody does, but, majority of folks. And you can find a way to get, if you really want to get a shot, you can find a way to get a shot. So, now, here are their examples of how this might work. Rural faith-based organizations could receive funding to conduct door-to-door outreach. I didn't think they wanted us to go door-to-door if we were not in the same family. Okay, somebody didn't think about this too much because we're getting mixed signals. Rural faith-based organizations could receive funding to conduct door-to-door outreach to schedule vaccination appointments in partnership with a community health center. Well, our community health center isn't getting any of these monies for that. And why aren't rural or any faith-based organizations maybe doing this on their own? Let me know. Is your local church or faith-based organization doing something of this nature? Let us know down in the, anyway, let us know down in the comments. Food assistance and housing nonprofit in high poverty communities could receive funding to conduct vaccine outreach and education to ensure its clients, including those with disabilities or limited mobility, have transportation to FEMA-supported mass vaccination. Now, again, more bureaucracy, more layer upon layer of bureaucracy putting into this thing. And just when you thought things might be getting better, here we are. Here's $330 million to invest in community health workers. So apparently we need way more community health workers. $32 million for training, technical assistance, and evaluation. This funding will be used to address disparities in access to COVID-19 related services such as testing, contact tracing. We haven't heard about that for a while. That was really big, 6 months ago? Your phone and everything were going to be contact tracing points, and they were looking for lots and lots of people to become contact tracers, and there was training and all that sort of stuff. We haven't heard about that, and all of a sudden contact tracing comes back up again. And people, please, food insecurity, what is that? Do you have suspect food? Do you wonder if it's good for you or not good for you, or is it, I don't know, food insecurity. A lot of buzzwords here that absolutely mean nothing. Anyway, that is it. You can, again, as I said, you can go to whitehouse.gov, click on the briefing room, and you can find, executive orders, these types of things, all there. We will put a link to this in the show notes, and along with a couple other things. Again, thank you for your time, your attention. We appreciate your watching this, and hopefully it has been informative, and we're looking forward to doing more of these types of things. So we'll put this in the show notes and get this up pretty soon. Thank you for your time and attention. Please like and share this so you get hit the little notification bell so you get notified when we do another one of these. I know I haven't done one in a while, but hey, bear with me. Anyway, so do that. Thanks again for your time and attention. We appreciate it. TheSwansenReport.net, 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 part of Fightback Media at fightbackmedia.com. And thanks, and we will talk with you all again real soon.